Headaches or neck tension often occur because the weight of the head is forward. The average head weighs 12 pounds. It's the size of a bowling ball. So imagine if I'm holding that bowling ball forward out in front, how much my muscles in the back have to work. So what we want to do is kind of pull the head back so our ears line up with the middle of our shoulders. Another thing to calm things down and to keep them calmed down is to regulate this pressure system. This can be hard during pregnancy because the baby is inside the abdominal wall. And then during postpartum, many moms don't retrain the system. So it's really hard to get back. So basically this pressure system, when we exhale, so when we're blowing air out, our pelvic floor rises a little bit because the pressure changes. So air is going out and the pelvic floor kind of gets sucked up from behind. Then when we inhale and bring air in, the diaphragm expands downward, pushing our abdominal viscera downward and allowing the pelvic floor to relax a little bit. So we get this nice rhythmical up and down during the day. But what happens with head and neck pain patients is they start doing shallow breaths. So there's like everything's up here and nothing's down here. And what happens is that drives the ribs up. So instead of like raise the roof, you're raising the ribs. So we want to expand the ribs, do this movement through here instead. So some simple ways to do that is to think about pulling that breath right through here, breathing in. I shouldn't see my shoulders move at all when I take that deep breath in. I can also bend over a countertop and try to breathe into the back. Try to breathe into each side to calm those headache, neck tensions down. Another way to get that rib back down is to use a dog leash, a yoga strap, a towel. Right after you get out of the bath, roll up one part of the towel, put it along here, and me, Tarzan, you, Jane, and then pull this across here, just like Tarzan's little outfit. But then I'm pulling this down and over towards my opposite hip, and then I'm just moving my head away and towards the rope, and then I'm going to move my head back into extension. Again, I'm pulling down on this rope pretty hard, but this is, again, pulling the rib down so that we can get some relaxation of those muscles. PTs often joke that this is like the most massaged bone because really the issue is sometimes those ribs are drawn upwards and it feels like your upper trap or your levator needs to be massaged, but instead we need some of this stuff to drop to get rid of the headaches. Another helpful tip with the same device is just getting some movement. So when I rotate my head side to side, tip it to the side, I'm seeing where I'm restricted. So if I feel really restricted on this side, what I'm going to do is cross the rope. The side that I want to move is on top, and then I'm going up and over towards the opposite corner of the room here. I'm keeping my hands nice and tight, and it's just gentle. So I'm moving both sides of the rope at the very same time and moving up and down. Now, if you can't see your PT right now, this is such a good way to get your neck moving. I barely ever get headaches, but if I ever do, I can almost always treat them out when I can feel that ucky feeling coming on by using this. So again, you're just crossing the rope. The one that you're moving is on this side. You can do both sides if you want, but we're really working that area and going all the way up and down the back of the neck. So I'm moving this here, I'm moving it down here, moving it here, and then that way we're treating each segment of the spine. And then I'm just following that up by pushing my head back to the sides and holding, to the sides and holding, to the front and holding there.